There are lots of people dying now from air pollution, and we just don't realize it because it's all around, and we know how the bacteria or virus spreads.
The role that climate change, air pollution has in our day-to-day practice is a challenge I think all of us face every single day.
There's trouble brewing, and it's brewing and it's increasing. We're at some kind of explosive turn. I think the unity of the fate of the patient and the fate of the clinician is a place to start thinking.
The COVID-19 crisis is showing us how vulnerable we are to existential threats. And the air pollution and climate crisis is an unconnected pandemic impacting our health, especially children's health and the communities impacted most by racial injustice. I traveled around the Southeast United States with the Climate Listening Project to listen to healthcare professionals who bear witness. How can we connect the dots to begin to heal?
We have air pollution surrounding us every day. And the same with climate change, we're already having impacts, stronger hurricanes or mosquitoes spreading a disease to a state where it's not been before. We get more fires, more heat illness.
When there's a fire someplace around, the wind brings that ash to you and that makes your air not good. When the air is not good, our lungs are gonna hurt.
This epidemic is presenting as diseases that we already have known of. They're lung disease, they're allergies, they're heart disease, they're things that already exist.
Premature births, increased risk of miscarriages, cardiovascular disease and strokes.
There are more allergies now because there are longer pollen seasons and the ragweed is actually more allergenic.
So this is just a small list of the adverse effects that we're seeing from air pollution, and we're on the front line dealing with this.
Care professionals are driven daily to face, endure, and heal tragic phenomena and experiences while often already in crisis with time, resources, pressures, and burnout. At the Narrative Healthcare Symposium in Asheville, North Carolina, health professionals are coming together from across the United States to talk about humanizing healthcare.
Our doctors, our nurses, our LPNs, our RNs, everyone who works in the hospital are still feeling human beings. The system in which they work is not. So how do we navigate this? The answer is through listening and through story on every single level.
The kind of listening that enables you to imagine and enter another's narrative world and do your best, at least momentarily, to see the world as that person does. I heard you say the word hope, and it fills my heart because it can feel that it's in short supply. I'm talking about ways of deeply, strategically, truthfully examining ways in which we are exploiting healthcare professionals, making sure that they have the kind of discretion and autonomy and control that they should. Healthcare is becoming far more curious and even knowledgeable about things beyond the physical body that contributes to health and illness.
So narrative healthcare is a set of tools that docs and other health professional folks can add to their toolbox to make the most of their time with their patients. And came into being to train medical students, but it has since really proved its utility in terms of interacting with clients and patients so that we can hear not only what's going on with their bodies, but what that means to them. That's one of the things that I learned in the HIV clinic, working with my earliest clients. It was a death sentence. But I was very blessed to be working with a team of people who understood the limits of medicine in the situation that we were in. And so what we could do is be a witness to people. And we were not there to witness people's disease. We were there to witness their humanity.
So, what is a healing wave?
What is a healing wave? A healing wave is when one person has gone through the process of becoming whole, and another person may have not had that, have gone through that process. They're able to share their story and their words, create healing for another person. And it lets them know that I'm not alone. It lets them know that there are other people who have gone through the process and they're able to get through. And that provides healing for their soul. And then they are able to share that with another person. So we create this wave by sharing our stories with one another. We can't deal with the climate issue. We can't deal with other issues until we do the human touch, until we deal with the story of others.
I think the value of listening to some of these stories, especially in periods of great change, whether it's climate change, social change, you know, I mean, we live in a world that seems to be in constant upheaval. In the past, as people didn't recognize epidemics, you know, because, you know, they didn't recognize Legionnaire's disease right away. They didn't recognize AIDS. We're listening to the individual stories is that you need to realize that when you hear one of these, you are going to hear it again. Well, I see you're not from here. Why did you move here? Well, you know, the island I lived on is now underwater. That's not going to happen to one person. You know, I couldn't take the risk of fires anymore. It'll at least help you begin to have an idea that, you know, this is going to be a common theme. This is a story I need to get ready for because I'm going to hear it again.
I traveled from my community in Western North Carolina to listen to health professionals who are responding to increasing threats throughout the Southeast and connecting the dots.
What is different about the subset of urban, poor, primarily children of color, that is keeping their asthma out of control? In urban areas, it can be up to 1 in 5 children have some respiratory disease. So for us that live in the South, where hot days are the majority of our days, pollution gets worse on hot days. The hotter we make those days, the worse we make pollution, the worse we make just daily living for children that have respiratory issues. I had a patient that was cared for in our practice who was a 14-year-old with asthma. And he had had very severe asthma for his entire life. When he was in elementary school, his teachers worked with his mother. They knew about his asthma. They recognized when he was having trouble. They made sure he was taking his medication. They knew not to let him out. Excuse me. They knew not to let him out until the bus was actually there. So he would stay in the nurse's office. He would do his homework. When the bus arrived in front, they would send him. He'd get on the bus and he'd go. He went to middle school, brand new school. He was a big boy now and didn't want people to know or understand about his asthma. And his teachers didn't know and understand him the way that they had in his elementary school. And as part of being a big boy, he wanted to stand and wait for the bus like everybody else. On the second week of school, he was waiting for the bus. He started to have an asthma attack and didn't want to tell anybody. Didn't have his inhaler because the school nurse had it locked up in the school, and he passed away that evening. I know I have felt really tired and beat down, and you look and you're like, I'm not making any difference, but we don't see the chain reactions that we often start. And to know that that's happening and that that's there, I think is what keeps us going every day. The fact that we're having this conversation today means that somebody does care. And as long as somebody cares, change will happen. And it's my job to just make sure that we are as healthy as we can be while that change is occurring.
Stories always matter. Stories can be histories to be honored. Stories can look outside of just the symptoms and pathology to fill in the spaces. And stories can be inspiration for change.
We see a lot more allergy here in the Southeast. The lush landscape, you look around and you see nothing but trees, but that also brings, allergies and pollen. So how do you take climate change epidemic and identify it as a causal source or a contributing factor, or is there a test for that? Well, probably not. So you have to be able to listen to your patients and hear their stories and be able to identify what is it in what they're telling you that may point to those things being causal or contributing factors.
So how can listening and storytelling help the patients and the communities where you're working?
I will tell you my story is that I was sitting in my office 6 years ago, and I had a father bring in his daughter, new patient, and it was looking like she had asthma. And so we were going through the diagnoses and, what to expect and the medications we were going to put her on. And there was no family history of asthma, no smokers in the family, not really any atopy, allergy in the family otherwise. And so he was very perplexed, about, how did this happen? And he was actually the one who asked me if it was because they lived very close to a major highway. That really resonated with me. And it actually is what called my attention to all of this and said, hey, patients are asking me about this now. I'm going to need to know more. So listening is key.
Listening and learning from each other is critical to solving environmental issues and investing in solutions prescribed by local communities.
I vary my schedule. I have some days where I stay until 6:30 p.m., some days where I come in at 6:30 a.m. And so on the days that I come in early, I park myself at the front desk so that I can kind of meet and greet families, so that if they've had this burning issue that they haven't been able to make their way to my office to bring up, they'll be like, you know what? I see Nurse Johnny, so now I remember, hey, Nurse Johnny, there's this thing I've been worried about for the past 8 weeks and I've been wanting to mention to you. There's a traffic light at our front desk, and the traffic light indicates the air quality for the day. So on the days that are code orange, I usually send a notice to the staff management team, and I'll send a note out to the parents. I've got to make sure that all of those kids with asthma have asthma action plans. I've got to make sure that we've got inhalers on site for all of those children, so that when there is a respiratory emergency, we can address it. I've been a nurse for 20 some odd years, and I don't remember the asthma prevalence being this high. And we've worked doing this work for about 8 years and collected data. And these are, again, birth to 5 children. And we have an asthma rate of 27%. And that's unheard of for such a young population. It's probably 2 or 3 times what we'd expect in this county. But because of all the factors that work against our families, against the well-being of our children, it's such an astronomically high rate. Because children are still dying from asthma, and how is that possible? Adults are still dying from asthma. How is that possible?
Humanizing healthcare and other systems is important to heal from extraction, destruction, and trauma, and build a future that is just. A Grand Rounds in Atlanta, Georgia, hosted in collaboration with Mothers and Others for Clean Air, brings together health professionals for an advanced medical training and conversation on weaving science and story for advocacy.
I talk about air pollution and climate change being a feedback loop because each one makes the other stronger. So air pollution started climate change, and then because it's hotter and more things we get more fires, then we have more air pollution. It's sort of like one amplifies the other, and it keeps going in a circle like a loop. The big cause of both air pollution and climate change is burning fossil fuels. We're spending a lot of money now on fossil fuel subsidies. We can equally spend money on keeping air pollution from happening and having clean transportation and clean energy sources.
The inspiration that most of us went into medicine was an interest in science, the natural science, and the application of that knowledge to improving human health. Well, the science of climatic change is unambiguous at this point in time. There's really no real doubt about the adverse effects. Very seldom do you see statistics and numbers change behavior unless they're aligned with some type of story that allows us to construct some type of meaning out of the numbers and the raw data. So it's an essential component of any advocacy strategy.
Connecting science and stories and making our voices heard can create healthy policies. We can create a wave of impact for a healthy planet.
Knowledge is power. And you know, even if you can't get out there and sign a petition on your own, you can educate your peers about how this is so important. You can, at a PTA meeting that you're at for your child, say something to that school that could maybe spark a light or an interest in somebody that's near you. Remember that your voice carries weight just by the profession that you have, and that there is opportunities every day for you to spread that knowledge.
If stories can be harnessed to make a point to the people who have the power to do something or to empower us, give us sustenance, they help mitigate, but they also help leverage change.
There cannot be any ripples or waves of healing unless, because they're part of the link. I mean, we're all in this together, whether we want to believe that or not. So it really takes collaboration, and it takes a team working together to ensure that change is being made in our communities.
If we can slow these changes that are inevitably happening to our planet, if we can do things to slow that loop, to decrease the pollution.
We've identified the problem, we know what it is, we know what the source is, we know how to measure it. I sort of see this as a great opportunity for myself and future generations of physicians to participate in this global effort. We have the reason to be inspired.
So get somebody on your team or find somebody in the community that's doing this work and support that work. Support it some sort of way.
And I think you can have not just an effect at the bedside. I think you can have an effect throughout a hospital. I think you can have an effect throughout a community. I think you can affect the culture. And that's really where I think the next phase for narrative medicine, narrative healthcare is to affect hospital cultures.
How we take care of the future that we've been given, our children, they are our future. We need to do everything, not just as physicians or as mothers or as teachers, but as people, to preserve our future. And preserving our future means caring about the little things that we can do to make sure that there is a future for them. As you gather people around you and let that voice get louder and louder and louder until it reaches the important places where change can be made.